no, we are not live anymore. As you may know, we were recording live for years, and now we are actually taking a recording of high quality and then putting them on YouTube for the people that want to take a look at the event later on. Also because we noticed there was more and more engagement, and not many people would actually like to stay home and look at Speck&Tech through their Facebook.
Yeah, the only way to get Speck&Tech live is now coming to Speck&Tech, so lucky for you.
Anyway, Speck&Tech number 38, this time it's named Healthcare Data, and it's co-organized with the EIT Health Alumni. We will get to know more about who they are and what is this foundation later on during the evening. We will have two speakers, and the first one will be Giulio.
Mr. Jovan, which is also one of the people I had the pleasure to work with. Just a second, we finished the whole presentation.
Jovan Stevovic, a big applause for him.
Yeah, thank you very much for being here.
Cool, and the second one is Francesco Lana. No, I'm joking, actually. He's ill, he got fever these days, so good luck to him, and we wish you a well recovery.
But I know some European initiative about healthcare that maybe can help him.
Yeah, it's funny. It's an event about healthcare, and this guy is ill, so we are perfectly on focus. But anyway, we were lucky enough that one of the people that were actually coming here for the event directly from the United States, Miguel Amador, he will be the second speaker.
Yeah, thank you very much.
So actually, the fastest replacement ever. It's incredible. As always, if you want to know more about Speck&Tech, what we've done in the past, especially for people who are here for the first time. Is anyone here for the first time? Can you raise your hands? Okay,
welcome.
Cool. Very few ones. It's interesting. Well, you can get to our website, speck&tech, and you find everything you're interested in. The upcoming events.
Everything you're interested in. our new motto, Speck&Tech, everything you're interested in.
Yeah, you find information about the previous events with all the slides, the video recordings, the photos of the night, and so on and so forth. You find the sponsors, openings, if you want like to sponsor one of our events or be one of the speakers. It's also possible to be done here. And you find also job openings. If you're looking for a new job, there are sponsors of the nights, and you find your opportunities. As always, follow us on Facebook, LinkedIn, Instagram, whatever you want, any social media.
Any social media you want.
Yeah. How can you support to help Speck&Tech running?
Well, it's easy. With money. Thank you. Jokes aside, we buy beer and Speck. Speck is for real. For people who is the first time we're coming, we do have Speck. It will come later.
We do have Speck.
Yes. Everything you want to eat. Also, we have vegetarian options such as cheese and I believe we have
crostini.
Some crostini if you're vegan. If you don't like beer, we have also Fanta. So we have
Tassoni.
No, we don't have Tassoni. Everything you want except Tassoni. So all this stuff is very expensive. Usually Francesco is paying in advance. So please help Francesco not being basically hijacked by Speck&Tech once again, and help us buying the beer like EIT helped us doing. No, I can't say beers in the Speck. No, cheese. Thanks for the cheese. And yeah.
Anyway, you can pay in a number of ways at the desk at the exit of the room at the end of the event.
Number of ways is two, like with cash or with Satispay. If you don't know Satispay, you can register to Satispay. They give you €5 for free, really, and then you can donate. And you look cool because like you donate €5, like small donation, and you help the event.
Yeah. At the same time, at the entrance of the venue, there's also the possibility to get free coupons. Keep in mind, every month we have a number of coupons for JetBrains Suites products, and actually they will expire at some point. So if you want to get for example, PyCharm or whatever software you want for free, come to our desk, get it, otherwise it will expire and it will be a pity. At the same time, we have 10% discount or 20% discount on Flixbus, which is also a great opportunity. And there are some beautiful stickers. There's going to be the new edition coming soon, so keep your eyes on.
And they are
And those
Amazing.
and those are our beautiful T-shirts.
And they are
with the
amazing.
Sam. This was the first edition. Some people are wearing the second. This was the third. At some point, there will come also the fourth one. So we will keep you posted.
Yeah, we had just to convince Francesco to give us the money before selling the T-shirts, but it's very easy. It's googleable. So.
And T-shirts are more expensive than cheese. Okay, three last things. First of all, we have
Three?
Three. Yeah,
Man.
yeah. First one, we have a partnership with Grusp. If you don't know who they are,
People who have no idea what is Grusp. Oh wow. Okay.
let's put a
So
segment.
Grusp, or in Italian, Grusp, they do conferences like since forever, or at least since I can remember. They do a lot of different conferences with the latest topics, such COBOL.
It's actually
Some of you are not laughing because they don't even know that COBOL is a thing. And this is even funnier. Well, COBOL is like the dinosaur programming language. Sorry if there are anyone who
Is
use
anyone
COBOL.
developing in COBOL here?
Yes, I'm very sorry for this joke. Sorry. And so they do a lot of different conferences. They are based in Verona, and they are very interesting. So if you are keen on any of those languages or frameworks or anything, we usually go with our company as well. They are super worth it. And
Tell us we have 10% discount.
yes,
and also
just write us. They do have a good discount for
and also
Speck&Tech.
we will share it on the social media, and we also have like free coupons that we will give out.
And
at
you
some
can
point.
go there by Flixbus, which we have a coupon as well. I mean, it's basically free.
Yeah. Actually, Cobble Day, just to say, it's on the 1st of April, and it started as a 1st April joke.
But then people were
Then
interested.
People
yeah.
were actually interested, and it became a thing.
Yeah, it's incredible.
So
it's incredible.
It's quite interesting. So this was option one. Second one is Django Girls. For any lady in this room or anyone that identifies as a female, there's. I wasn't laughing, people. I was serious, fucking serious. There's this event on the 29th of February happening in Trento. It's basically for people that are starting to code and get their website up via Django. And you will have a lot of trainers, females, males, and whoever you want, training you from 8:30 to 7 p.m. how to actually get your website up and rolling. So for everyone that doesn't really have great knowledge of tech, but it's still in tech somehow, or would like to get a website,
Or just curious, to be honest.
or just curious to learn how to program, it's a great opportunity. 29th of February, and we also have some mentors and the teachers in the room. And I'm looking at Alessia and those organizers. So if you want to get to know more, go and talk to her later on.
Alessia, which identify as a programmer.
Ciao. Okay, final point of the night. We already have the next event ready. 16th of March. It's a Monday, so for the people that are going to Ludimus, you will need to skip this time.
If you don't know Ludimus, well, it's okay.
Anyway, 16th of March, the topic is still not disclosed, but stay tuned on our social media. We will reveal it soon. We have speakers from, I would say, two of the
We have like
biggest-
super cool speakers,
yeah,
to be
like-
honest. It's one of the like, it's not the city of Cloudflare again, I'm sorry, he's busy. But we do have really good speakers. So if you are into mostly the programming side of tech, so it's not like, let's say, soft skills or design or entrepreneurship. It's like really.
So I will go see here.
Sorry, me too. Bye. We finished the event. No, really, like if you're into programming and mostly on the backend side of the matter, keep the date saved on your calendar because it's super worth it. It's super worth it.
Yeah, and this was enough. Okay, we went
very
long
excited.
as always. Final point of the night. ST38 for questions to the speakers. Go on slide.do and insert this code, or go to slide.do/ST38. And
There
you can
is no
ask,
coupon
the
there,
question.
but
but you can get €5 discount.
So true.
But you can ask questions to our first two speakers. And we started the night with the first speaker, JOVAN STEVOVIC.
Welcome, Jovan.
Company. So it's a good coincidence together with Stefano. We won We won the first prize at EAT Digital, and today we are talking about EAT Health. So EAT is a good network. It's a great network. It helps companies to bootstrap. We got 40,000 euro in cash. So if you want to get some cash to start your company, EAT Health is a great environment, or EAT Digital, whatever the topic is you have in mind. What is specific about us? So I'm going to have 27 minutes, so I don't want to be so long. So what is the specific about our company, our startup? We are 5 years old, so we are there in the middle between startup and company. It's specific that we know about healthcare, the healthcare environment, the healthcare technologies, and the healthcare sector. Technologies for development, cloud technologies, development technologies, and law and data security, also thanks to our lawyer, Nicola, sitting here. So we combine all those three things to help companies to solve data protection and security when building healthcare products in the cloud, typically, because nowadays everything is cloud-based. So this is our customers. The biggest is Bayer, it's a pharma company. The others are all small. But that's how we started, working with quite many startups, a lot of startups. If you want to start a company, never work with startups. So work with big companies. And we worked with partners like Belka, amazing company, really cool stuff. They still need to finish our work. I had to do it. And we won some funds, in total 1.5 million so far in grants that we won as a company. So we are quite good in grants. Why we started the company? 1 million e-health services or health tech services out there, apps, mobile apps, web applications, and so on. When we started, there were like 150,000. Now it's like more than 1 million out there on the market. According to statistics, still the same statistic from 2014, just confirming every year, more than 85% of them suck at privacy. They have all problems of privacy and security. For example, a startup in Berlin, amazing, they got like 10 million euro in investment after, I don't give the name here, so don't, but just to give an example. 2 weeks after they launched, somebody discovered that using a logging service from US before getting the consent, you download the app, you start using, they get some data from you before asking you, do you accept privacy policy? Newspapers. After 2 months, a security agency discovered that they have some much bigger issues on APIs, and they finished again after 2 months on newspapers. So can you imagine what happens with this startup? It's not going really well, because this kind of publicity in healthcare, especially in Germany, because this is German market, doesn't work. This startup is basically killed because of this bad news and so on. How many of you watched 2 days ago Presa Diretta, Rai 3? None. Oh, shit. No, it's good that nobody's watching the TV, but it's bad that nobody watched Presa Diretta, which is, I consider, quite interesting. Well, anyway, on Presa Diretta, they were talking about exactly the same topic, healthcare and data and privacy, how we are getting spied on internet. And they were showing toys, new toys, that are leaking some data. They were showing thermometri sociali, so these kind of thermometers that were also sharing the data through apps to the parents, and also leaking some data. They were showing sexy toys, leaking data also, because these companies collecting all the data, how much they are used, where, frequency and stuff. You can imagine. A lot of stuff. Very bad. And you have seen this guy there, especially with this face in the last years, because he ended up many times on newspapers because. So this is not his fault, but he provides the technology to collect this data. But there are hundreds of female tracking applications, very useful, but at the end, 70-something% of them is sharing data with Facebook. Why? Even Facebook doesn't know, because they track this data with events, and Facebook doesn't want really this detailed data, but developers of those applications just embed the social login, and they use events, and they share the data with Mark, and poor Mark, end up saying, you know, I didn't really want that. So, why data and why all this topic? Well, data is money. We have discovered that many years with the topic of data economy. Big 4 tech companies in the world are all relying on data economy. But now we are more talking about surveillance capitalism. So it's becoming more and more a bad thing, thanks to this lady, Shoshana Zuboff, who created this term. So you can check this book, but you can start also with Netflix, something more lighter. You can watch The Great Hack. It's related to Cambridge Analytica and how Cambridge Analytica was created. Presa Diretta was showing how Cinque Stelle was actually one of the first creating this topic and probably even better than Cambridge Analytica, but we still don't know that. So you can start with that. You can start with Carol Cadwalladr or something similar. She teaches you on TEDx how people were hijacked to vote leave in UK, so to leave the European Union in places where there were no immigrants and they were living quite good life. And of course, Snowden with Citizen4, which is not really on the topic, but good to get an idea what is surveillance in general. So, about privacy, data protection, and security, going into more European legal framework that defines rules for healthcare. So it's important to distinguish the terminology and to use proper terms, since here we are educated and smart people. Privacy is different than data security or security in general, and it's also different by the new GDPR. I'm quite sure you received some newsletters about GDPR, so you're familiar. I'm not going to ask that. Right. So all those 3 things are very important, very different. So privacy is a human right. You are being surveilled by governments in many countries, as Snowden teaches that. You are being surveilled by tech companies and so on. This doesn't mean that GDPR, the European law for data protection, is violated or that data security is violated. Actually, all the big companies relying on data economy are the most secure companies because they protect in the best way their treasure, which is the data. So security, you know, is about data encryption, protecting it. So if somebody is violating your privacy, first of all, doesn't mean that it's violating the GDPR, the European law, and doesn't mean that it's violating data security. GDPR is the law that we got last year. 2018 actually. Yeah, 2018 is the law that defines quite many things. People are pushing GDPR and laws to cover everything about privacy, but companies are pushing the law outside in order to be able to violate your privacy without violating a law. So this is also a bit of a fight here. So, for example, GDPR defines also some rules called data subject rules, which are not really on privacy violating, for example, data portability, so that you can, if you use one telco operator, you can pass to another telco operator. Basically, the app provider has to provide that functionality, but if they don't, they're violating the rule, the law, but doesn't mean that they are violating your privacy. It's just a right. So it's important to clarify that. Why? Because now I'm going to define what is personal, what is health data, and how GDPR defines laws and rules that you need to follow if you want to develop a health application and launch it on the market. Unfortunately, today we are not going to have an example of those health applications because TeaCare is developing one of them. And very successful, one of the best Italian health tech startups currently, because they got quite a lot of investments recently from NanaCare and also other investors. So, personal versus health data, first of all. When GDPR applies? GDPR applies when there are identifiable data, which is typically anything related to a person that can identify a person, and typically this is called personal data. For example, identifier is a name, a number, identifying like codice fiscale in Italy. Location data, online identifiers, email, for example, genetic or mental, economical, and everything that identifies a person. So this is called identifiers. Health data is called, it's a special category of data. So correct term is special category. It's not anymore sensitive. With the previous law, it was called sensitive. Now it's special category. So it's anything that is personal data related to physical or mental health of a natural person. So you need to combine the personal and something relating to your physical or mental health. So why it's so special? Well, because clearly you can be discriminated if somebody gets to know this kind of information. Your employer, in some countries, health insurance, not in Italy, but in Germany, in UK, in US especially, you can be discriminated about that. But there are also other type of health, of sensitive data or special categories of data, like racial, political opinions, your genetic data, religious beliefs, trade union memberships, biometric. And then there is this special category called fitness and well-being, which is typically Fitbit or those fitness trackers. They're a bit in the gray zone. It is sensitive data, but if they don't really provide you some health advice, it's not considered health sensitive. And why they're in gray zone, why they're trying to stay in the yellow part, because the red part means that if you are misusing this data for advertising, to resell to somebody else, you can end up in jail, even though you are working as a CEO of a company, as an owner of a company. If you misuse personal data, your company gets a fine. 1 million, Telecom Italia is paying 38 million euro from last week, a news, for violating, they called 150 times a person for telemarketing. So if you call 150 times, it's okay, right? So 38 million, but as a fine. Nobody from the board of Telecom Italia is going to end up in jail. If they were treating and managing health-sensitive data, potentially could end up in jail as criminal, due to criminal charges. So in Italian is responsabilità penale. Right? Am I right? Yes, cool. So asking for lawyers' confirmation is always a good thing. So, so this is the health-sensitive data and why it's important. Then typically companies are dealing with anonymous data. Anonymous data is typically some statistics information that you want to extract from real data in order to monitor people, to do some analytics, to do some statistics. It's called also business intelligence, but that was a bit of an old term. Now we are calling it analytics and so on. But typically, when you aggregate, you get identification. So anonymizing data is extremely, extremely difficult. I will show you a couple of cases. But before showing the cases, what people confuse with anonymous data is pseudo-anonymous data. Pseudo-anonymous data is when you remove just the name and surname and you keep like a health record with just an ID, numerical ID, like patient number 1 got disease number, got the coronavirus. Okay, if you keep that and you keep that number, this is still pseudonymous data. Why? Because we started with this topic of anonymization and pseudonymization in the literature back in 2000s. I think this case was 2006, Netflix also somehow. So OWL, American Online, probably you don't know it, but it was the biggest search engine before Google. And they were quite big and popular, and they, at some point, their team released all search queries made by, for example, this case, by the person 998280, and all search queries, and they said, okay, this is public, right? It's anonymous. It wasn't anonymous. Many people discovered people searching crazy stuff. Police identified criminals. There are videos on YouTube about creepy things, about like a lonely woman searching for fun in the town. And all those people were identified. They got a huge fine, and the researchers were fired from the company. Same thing happened to Netflix. Netflix released the movie preference data and said, okay, if you improve our recommendation algorithm, we give you 1 million. They got 3 or 4 million of fine because people, those two researchers cited here, they were able to write a paper about that and saying we identified people based on movie preferences, combining this data with other preferences on internet like EMDB or other, let's say, catalogs where they were found. So movie preferences represented a huge scandal. So it's important to distinguish between pseudonymous and anonymous data. A bit more in healthcare, just to get things a bit complex. So this is a set of laws and that apply for healthcare applications. So if you had an idea for a startup in healthcare, probably after this talk you're going to change your mind. But fortunately there is Chino.io that can help you. We have startup-friendly pricing, or not anymore, but yeah. So GDPR in Europe, HIPAA in US, MDR, FDA, health-related standards, and other laws, standards, certifications, they all represent a huge, as you can understand, a huge problem for anyone developing an application. This is how we define what, for example, cloud providers help typically companies to implement their applications. So cloud providers help you to solve the security of the cloud and protect the perimeters of the cloud, the hosting, while everything in red has to be implemented or solved with lawyers for a health application. And this is a huge problem for developers of these kind of applications, and we at Chino.io, we help them. So we help them basically to identify what data they do, they manage, for which purposes they are managing. Today we assisted a company that is fighting cancer via social network and providing a community to cancer patients. We help them to understand that first they don't need to use Facebook chat to connect with people, that you should build something more serious. They shouldn't use this consent tracking in a wrong way. They should first ask users the consent and then send the data. And all those things today, that was our working day, and that's what we, help companies to make sure that they do everything properly with our technology. This is a bit more a techie diagram. Belka is helping us to make this more understandable by people, right? Maybe not. Yeah. So how our technology works? How many are you familiar about Google Firebase? Anyone? Oh, cool. Oh, quite many people. Yeah. So I expected a tech audience. That's why I put this here. So Google Firebase basically provides you something like Chino.io just for general purpose applications. We provide something similar for healthcare. So why I'm saying similar, because there are many functionalities that Google Firebase has, and there are some functionalities that we have that Google doesn't have. But we are certified, encrypted, and secure for health data. And what is a backend as a service? So it's a service that provides you storage, like Firebase, user management, sign-ups, logins, and so on. And you can do some calculations and so on. So the same things you can do with Chino.io, with our platform via APIs. You plug and play, and you outsource to us the most complex things, and plus consent tracking and so on and so forth. And then you focus on your front ends, your algorithms, and so on. So that's what we do. And again, more than 50 companies across Europe are using that for their own applications. In very diverse, we have customers building female tracking apps, applications for children with autism, telemedicine platforms, some kind of sensors for reminding elderly people to take their own pills, anything that is basically collects or stores sensitive data. At the end, what we offer them, what we help them is eliminate data management risks, save cost and time, and stay compliant over the time, and so on. So this is the amazing team that is behind Chino.io. We are currently 10 people plus 2 amazing advisors. So me and Stefano, and most of the people are located in Berlin, where is our second office. Covering all aspects that you need to cover in a company, like sales and business development, marketing, legal and data protection, developers and advisors. You need that also because if you're starting your own company, you don't know many things, and they need to advise you. And yeah, as I said, combining different things in addition to the 1.5 million euro that we needed to create this team and create the product. Yeah, I guess that's all. That's what I said.
I'm reading some questions that are quite funny. It doesn't have to do with this, but it's...
There are no stupid questions, only stupid answers.
There are stupid questions, I'm sorry. Okay, first one. Which kind of businesses and organizations usually approach Chino.io for its services?
Which kind of business?
Businesses or organizations approach Chino.io for their services?
Well, anyone developing a health application. So anyone developing something that is related to healthcare data. It can be B2C, B2B, chats, apps like today, or telemedicine applications or anything. Yeah.
And what is the most, let's say, important part of the process that they outsource to you in this case?
Well, everything related to sensitive data management. So we started with a very technical, briefly, we started with a very technical thing like data storage. You use us to store the data. But then we evolved, as I showed you, we evolved in something that solves all the problems related to compliance. So basically, they approach us to solve now a problem. Today, a guy got a few millions of investment from Sweden, called us, yeah, we have this amazing app, we have 7,000 users, and by summer we plan to have 500,000 users. I said, cool, good plans. Cool, we don't have anything on privacy and security. Cool, it's like, let's talk. And we organized a call, and we're going to make him a proposal to fix everything they need to fix. So that's it.
Okay, they're asking if your API are secure, and how do you believe so? And do you do any
I need to
checks?
involve my lawyer and my CTO to answer this question. But if you are a security expert, actually, you can try to hack them and then let us know before releasing, because there is private sensitive data in the system. So yeah, actually, I'm serious. I mean, if there is somebody security expert, we are happy to have interns and new employees. We are looking for that. So yeah, actually, security experts and DevOps, if there is anyone here.
They're asking, I don't know if you actually can reply about to this question, but if for team, you help with the development of an app for telemedicine and prototype or any products that were planned to be. I don't know if you can reply, or maybe...
So if we prototype...
Yeah. If you help them with the prototype and development of an app for telemedicine.
No, actually we don't prototype by ourselves the product, but we know amazing software agencies and companies can do that. Yeah, so some of them are sitting here. So we work a lot with partnerships with software agencies, so they finish the product for the customer, they listen to the customer, and they just use our service to outsource the complex stuff, the ugly stuff.
Cool.
Risky stuff.
Last two questions. These are the less serious ones. First one is Speck healthy?
Speck healthy? I don't get it.
Speck is healthy.
If Speck is healthy. Well, it's not sensitive, so it's healthy.
And the last one, since you also studied at the University of Trento a couple of years ago, is S3 GDPR compliant?
It's a good question. It's a good question. I actually worked a bit somehow surrounding S3, so no, it's not.
Thanks for your sincere feedback, and yeah, big applause to him.
Thanks.
Okay. Before moving on to the second speaker, we have like 5 minutes from our two guests, Luciana, coming here directly today from Treviso, so a Veneta friend, And then we have also Adriano. They're going to tell us a bit more about what is EIT Health and EIT Health Alumni. As you know, they're supporting the event, and at the end of the event itself, you'll be entitled to register and become a member of the European Association. So 5 minutes to you, and thanks a lot for supporting the event.
Thank you to you. Where is Thank you for these introductions and also for inviting me to this interesting event, even if I am vegetarian, but okay. Next one, tofu and Speck&Tech. My name is Luciana Gualdi. I'm a project manager for Southern Europe in EIT Health InnoStars, and even interim regional manager. Yeah, give me that one. I'm here to give you a brief introductions of what is EIT Health and the opportunity within our program. So, what is EIT Health? So EIT Health, it's a network, essentially, a network that collects the major and more representative healthcare players in Europe. And to do that, EIT Health tried to submit and gave the opportunity to maintain the knowledge triangle. So we bring together the business, the education, and the research in order to give them the best opportunity to perform their innovation idea. How we do that? We identify the unmet clinical and economical needs. So essentially, we gave to European innovator the access to the market, gave fundings, and best of all, we gave them the expertise of our network. So we basically improving the healthy lives in Europe, giving to the innovation in Europe the opportunity to create new product and service in Europe. We also have education programs too, so we educate citizens, but also students and entrepreneurs in order to be more efficient and more successful in their idea or in their creativity. How EIT Health is organized, I try to be really, really quick. There is, at the moment, 150 partners across all Europe, and these partners are organized in CLC, that is co-located centers. Italy is placed in InnoStars, that is the CLC that brings Poland, Hungary, Portugal, and Italy. There is 22 partners in InnoStars. So the circle in red is our Italian partners, but it's still not updated because for 2020 we have another partner that is inserted in InnoStars. So as you can imagine, the partner in EIT Health is continuously growing and interested to be part of our network. Okay, so as I more or less mentioned, EIT Health gave the opportunity to create, to facilitate, and to bring new collaboration, and also to educate. And this can be thanks to different kind of programs, innovation program, campus programs, and accelerator opportunities. Very quickly, accelerator opportunities is for scientists, startups, or SME. So probably here in this room there is someone that could be interested, but I'd like to focus my 2 minutes, I guess, in campus program, because I think that is more interesting for you. So the campus portfolio, it's essentially intended for 4 stakeholders: students, entrepreneurs and innovators, citizens, and executive and professionals. So for students, we have degree and non-degree programs. That means we have master and PhD programs, such as summer school, innovation day. For entrepreneurs and innovation means, again, student or PhD. Don't you think about some creational or some startup already created. No, we talk about students again. And also for executive and professional, there is some program specific for students, PhD student or postdoc. So just to give you a little bit examples of our programs, this is just a couple of examples for every kind of pillar, okay? The catalog of campus program is so huge that I can't imagine how to learn it. So essentially, a big view of 2 student program. Innovation Day is for undergraduate and graduate students. It's a 1 to 2 day program that helps you to give the tool for innovation in health, of course, and to organize your creativity, your idea. There is even a summer school, again, to bring you the concept to idea, to financial sustainability and feasibility. And for entrepreneurs, innovation, okay, Starship is already closed because the deadline was in 31 January, but there is, again, Startup Lab and also other kind of program for entrepreneurs and innovators. And this is for student, PhD, entrepreneurs, researchers from different kind of disciplines, so medicine, life science, economy, IT probably. Okay, so it's really interesting because it's 3-month e-lab organized in parallel in 3 different countries, or better, in 3 different cities, Lodz, Naples, and Tartu. So I should have finished my presentation. For any other question, or maybe for many information about the catalog, please doesn't hesitate to contact us, and then I let you continue. In the last slide. So thank you. It's your time.
So thank you, Luciana. It's a pleasure to be here. I'm Adriano, the local representative of the IT Health alumni. Actually, this is the first activity here in Italy from the alumni network. So what is EIT Health Alumni? The association is a group of multidisciplinary healthcare professionals that attended an EIT Health initiative programming, such as a summer school. And the great thing is that today, by attending this event, you are eligible to become an alumni. So what does it mean to be an alumni? Well, it gives you a lot of opportunities, such as attending sponsored programs around Europe, win free tickets to attend the Health Summit, and also become a coach, receive mentoring. All the opportunities for the alumni are posted on this website. Okay, just for example, last year, alumni had the chance to attend an event in Nuremberg related to MedTech, to go to Riga, and also attend the EIT Alumni Connect in Budapest. So these are the contacts of Chiara, Antonio, and Luciana from the IT Health InnoStars. And if you have any question, something, you can also reach out to me. So register now and become an alumni today. Thank you.
Oh. Okay, thanks, Adriano. We will share the link anyway on our social media in the next few days. Thanks a lot for supporting us. If you want to get more information at the end of the event, feel free to get to any of Luciana, Adriano, or Miguel itself. Miguel, second speaker, coming directly from the US on a detour from Portugal. The stage is yours. Half an hour kicking now. Big applause for him as well.
So this is always a challenge being the replacement, but I'll try to bring a little bit of my passion around healthcare data, the work I've been doing around that topic, and not necessarily bring such concrete expertise like you had with China.io, but a little bit perspective of actually. One thing is healthcare data, the other what you are doing with that, what you can do with that. So I'll bring you a little bit on the beginning how actually health data is being used to develop digital health, and also look into what are the challenges with health data. To present a little bit myself, so I'm the president of the EIT Health Alumni. How did I get to become the president? I was basically part of the first summer school of EIT Health, so nothing fancy there. But it's amazing of this amazing community that again represented, and it spins out a lot from the work of EIT Health to bring this big community of healthcare innovators. So I'm glad that I was able to come to this event, and I could share a little bit the work I started doing during my PhD. I'm a biomedical engineer, and I've been working in my PhD in the MIT Portugal program on the topic of using real-world data to actually move medicines quicker into the markets. And the big challenge that we came there when speaking with FDA, speaking with European Medical Agency about data, is actually everyone was seated around data. And no one wants to share data. Even the hospitals, when you speak about data, for them is a liability, is a security issue. And while Facebook is using data to decide elections, we actually not allowing innovation, healthcare to improve because healthcare data has been stuck. So I got this passion about healthcare data and how can actually we can free data, healthcare data, to the better use of the public. And since during my PhD, I started working in incubating healthcare, working with different healthcare startups, and most recently last year I started working in my own companies related, working always with data as digital health, and in the regulatory part also of health. So this gives a little bit the perspective of why I'm speaking to you about healthcare data, but what brings me here is to talk a little bit about what is the trends on digital health, because in the end, what you're speaking here is the kind of applications that you can do with China.io, that you can do with amazing technology that is out there. But the challenge is that we are not still living in healthcare the same benefits of the digitalization. The data that in the end is the basics of the digitalization that you have on dating, for instance, or other areas of our life. So when you look into what is this digital health, when you speak of digital health, we need to look what is actually medicine and the basis of medicine. And 100 years ago, basically the technology that you had in health was almost none. So was the human touch the technology? You touch people. It was how you actually understood if someone has whatever they come up as diseases by then, using the touch. Then you move until probably 30 years ago, or starting probably in the end of the 50s, 60s, what you can call a more machine-assisted area of healthcare. When you call machine-assisted, when you extend the human touch, the human sensing with machines. So amplifying images, amplifying sounds, recording things, using different kind of energy, light, so you can see through things. So it was in some way expanding the sensing capabilities of the human being using machines. And that's what often is called the analog health. So in some way you are using probably some digital components, but the essence of healthcare was, and is mostly in this case is still the use of expanding the sensing capabilities of the human. When we enter in the digital health, what actually we're doing is replacing not only the sensing capabilities of the human, but also the brain capabilities of the human being. And this is where things get tricky. Because while you can explain to a medical doctor that this X-ray image is actually the bones inside the human body, because that is obvious to compute in the human brain, how do you explain that this number that you come up with an algorithm is actually a predictor of cancer 20 years from now? How can a doctor understand that when you run some fancy machine learning algorithms in the black box system that you don't even know how to explain why it predicts that way. It just feeds billion and million of data that no human can compute, and the computer, in the end, delivers that result. You test it, you know that is working, but you cannot explain. And this is a tricky with digital health today, because it goes beyond what we can understand. But we cannot forget that the main goal of digital health and healthcare, when we speak about healthcare data, there is only a point of using that data when you are actually using the tech for what is usually three things when you want to create a business, when you create an innovation, and three things. You don't need to do everything. If you do everything, even better, but is to improve outcomes, so improve the health of someone, reduce the costs of delivering that healthcare, and increase the access in healthcare. So when you talk about digital health, you are probably looking to huge potentials to deliver in any of these areas, or even all these areas together. So there is a lot of potential in digital health, but the challenge here is that technology adoption takes time. China.io was speaking here about cloud computing in the essence. Cloud computing is still a challenge in hospitals. A lot of hospitals, a lot of institutions, they are still not in cloud computing. So a lot of the technologies that we see on TV, that we see on universities on research, and many of them actually are being used by many doctors in many places. They will take time to be adopted across the world. This is an example of different technologies, how long they took to get adopted. For instance, it took 40 years for electricity to be in more than 60% of the households in the US. So this electricity, quite basic commodity today, it took time to actually spread around people. Of course, in the most recent years, technology has increased the speed of adoption, but still is a tricky challenge. And the key point here is that a lot of the technology in healthcare takes time to get adopted. The majority of the cases I face working with innovators, working entrepreneurs, they're trying to push for technology because they don't see the technology in their lives, but the technology already exists. You don't need to create the new databases for storing data. You just use China.io. Then you need to pay me for the free advertising. But the key point is how you use that data to do something that delivers value for people in healthcare. How you can actually convince people to adopt you quicker, to trust on your technology, to use it. And that's a tricky challenge, how to increase adoption. Just to give an example in healthcare, MRI, so you know MRI through the machine resonance imaging, took 40 years to become a mainstream equipment for imaging as it is today. So all these technologies take time, and a lot of the things that we see using data and digital health are things that start appearing in 2005. So we are still 15 years behind probably the curve of adoption of using cell phones in healthcare, if you look in this way. This is a similar curve of hype. If you came from management, you know often this curve. This is like the hype of technologies along the time, and this is focused on digital health. And here you can see how different technologies that we're speaking in digital health are in different stages of actually what is the technology appears. Now you can do these kind of things. Now you can do teletransportation of patients around hospitals. But it does not mean that will be adopted. Then you have a lot of expectations. Blockchain will solve the issues of the world in healthcare. This device will be the cure for cancer, this kind of stuff. But in the end, you start, nothing is happening, nothing is coming out, and you go through the dissolution. Okay, technology actually is worthless. Is never coming to be in place. But the truth is, many of those finally end the plateau of productivity, and actually you don't even notice that they are there. A lot of the technology that is here in this room, you don't think about Wi-Fi. this kind of stuff. It simply exists. So things take time, and when they appear to your life, you no longer probably are speaking or thinking about them. So this is a little bit of framing around adoption of technology and why sometimes us as engineers, we have a frustrated life because we see technology here. We see the doctor there, and like, why you're not using this? Like, this is such an obvious help for you. You just need to run to the computer and give you the answer. But this is more tricky than actually the technology to reach people to improve healthcare. So moving, I'll bring you a little bit of examples of people are using digital health and of course applications of health data to do different things and what are happening now, not necessarily being fully adopted, but for you to be aware of the different things that digital health is enabling now. One of the key areas that is really interesting on digital health is what is called the digital therapeutics. So now instead of using a drug or a medicine to do a biological effect on someone or traditional medical devices where you just break something or pump some insulin or do some kind of physical interactions, now you do digital interactions. And this digital interaction can span out from mental diseases, for instance, so coaching, treatments that in some way help you to overcome some of the fears, some of the depression, some of these kind of things, but can be, for instance, a management tool for your medication or management tool for the way you eat. And these apps, these technologies, these digital tools are showing, in many cases, the ability to have probably even more effect than a drug. An app that helps you to eat better, to do more exercise, that influence your behaviors and helps you to change your behaviors, may prevent more diabetes or reduce your diabetic level better than more insulin or better insulin. That's why they are called digital therapeutics, because there is a huge potential that often is tricky to measure, because again, you need a lot of data, access a lot of data, not only from the use of your app, but actually from the personal life of that person to understand if the impact you're doing. So often this is the limitations on things. But this is an example. I brought you here 2 examples. The one in the top is a normal pill, but they attach an app to that pill that helps you to track. So this is peer therapeutics. They are selling to the Sanofi, to the big companies, pharmaceutical companies. It's just like a digital enhancement of the pill. But with that, the combination between the normal medicine and the app, they are more effective than the medicine itself. So they are being approved as a bundle, as a new drug. On the bottom is actually a Portuguese, almost all examples I brought here also Portuguese, but this is a company now working mostly in the US for physical rehabilitation at home. So what they do is they monitoring the movements of a person with a stroke, and they can guide the movements and see if the person is doing the rehabilitation exercise properly, avoiding this way people to going to the hospital, being guided with a person, how to do the rehabilitation exercise, and now they can do it at home, they can do it more regularly, more frequently, and with that getting more improvement and better outcomes. And this is the kind of treatments and things that you can do with digital tools that can be simply delivered in a box to your home. Another area that is being quite developed is on the value chain of pharmacies. These are mostly, if not all, US cases. There is not many big companies in digital health in this space in Europe, especially because US is a big market. And a good example is Pillbox that was recently bought by Amazon. And what they do, they ship you weekly your medication in a box. So they have this, since in the US you can buy what is called a unidose, so you get 5 pills for the 5 days. They just put a pill in the morning, a pill in the afternoon, so you just need to take the pill on the correct day. This is a kind of not direct use of data, but in some way they are informed with data to deliver a better service, more automated. They simply ship you everything you need, and they keep track of things, so you don't need even to go to pharmacy to replace your medication. A lot of things are happening on insurance, and here becomes sometimes the issue of actually what data should you share with insurance, what can you use from your data. This is a tricky area, but still there is many examples of, for instance, Oscar, that is an insurance company in the US, that they bet on using digital tools to provide you with digital tools, because they know with that they can help you to prevent diseases, and with that you pay a lower premium. They establish a more digital relationship with you and help you more with your health than just paying for your bills in the end. So there's a lot of things being done here. For instance, a lot of the things they are pushing is for telemedicine, so you being able to just whatever happened to you, you connect with them and get feedback from a doctor remotely. So in the way they are using data and digital health to cut costs and overcome limitations, and giving more access and lowering the cost on insurance. Another area that is quite a challenge on health data, and is booming a lot, both in US, both in Europe, is the point of genomics. Now, you can simply order kits, get your genome sequenced, and you have access in the platform to data, know your relatives, know some diseases that you have, that you may have based on genomic data. There's a lot of controversy in the way here, because how the information getting from your data is really true, and should you believe in that data? And that has become probably one of the main challenges, being this probably the first digital health massive delivered to consumers, is how the information you're getting from these tools, from these digital apps, from these algorithms, is actually something that you should trust. What defines what is trustful or not? When a human being many of the times cannot even understand the results. So this becomes often more an issue of trust, of communication, of understanding that information, that necessarily the technology behind it. For instance, 23andMe also, when it comes with data, is quite important, because they sell this quite cheap. It's like $129 a test that you do, instead of doing like for 5,000 or something that is the market. Because this is like Facebook. Actually, this is from the previous wife from Sergey Pin from Google. Because you are the product, you are not their clients. They are selling your data, your DNA data, aggregated, pseudonymized, whatsoever, using China IO to protect everything eventually. But they are selling your data to third parties, and there is no technology that avoids that. It's just a matter of the privacy, your personal privacy, and you need to trust them that they are properly using the data when they sell it to companies. But at the same time, those companies are now bringing new medicines to market based on that data. So there is always a big discussion. Healthcare is on the point of healthcare data is actually water, in the way that everyone should have access to it. Is important for everyone, benefits to share that water, that healthcare data. But at the same time, that is vital to you. Is something that is not properly managed will be hurting you. So you cannot just dump chemicals into water because it will ruin cities and harm you. The same way on healthcare data is something that is in some way can bring a lot of value to people, but at the same time can be really risky. So there is always this conflict in the industry of how to use healthcare data, how people will react to things, how to protect things, because you can never protect 100% things on the digital world. So what in the end ends to be easier to kill people with the medicine, because it's like, okay, this is risky, but when you go to probably dealing with digital health with data, just harming someone, one single person comes into the news and you may be simply out of business, or even not only you can ruin a full industry or full area of innovation. So a lot of things are also coming to consumer health, wellness, so you have a lot of apps that are working on meditation, on helping to manage fears. Then it becomes the issue, like it's not health data, but it's quite personal data, like well, how sensitive actually is not the data of Donald Trump up on meditation when he simply says his fears out loud to the app. So it becomes a challenge on even these apps, because most of them are not regulated as much as medical devices or other healthcare apps. That's why we are seeing here the majority of the companies working in health, they are not at all compliant. They don't even know that what compliance is. Probably GDPR was the first time they heard about compliance, but there was already privacy laws in place before that were not compliant at all. Moving quicker, you have a lot of technology related with administrative things. How you deal with infrastructure, bringing data from hospitals to clouds, doing actually a lot of things of trying to streamline all the process inside the hospitals. Then you are bringing hospitals to people, the telemedicine, the primary care service that you no longer need to go to a doctor in the hospital. You can simply do most of the things remotely through a chatbot online. So a lot of things are happening in that side, both to improve the experience when you go into a hospital, and principally and mainly to when you don't need to go to a hospital. For instance, Babylon Health, they're running, for instance, with the full county of the UK, running all their screening on the national healthcare system. So they do a screening of people through a chatbot, then they push people to telemedicine person, and then that person may take them to the hospital. And they are deploying this already at the regional scale in the UK. So this is a good example of things happening. But this is chatbots, this is Skype. Like I use Skype since 2021, or like almost 20 years ago I used Skype, so it's not fancy new technology. So you have also a lot of things for special care. For instance, this is also from Alumni, is from EIT Health, where is to monitor alcohol addiction. So you like to do testing at home, so you don't need, it helps you on the recovery when you need to do some kind of testing, mental areas, etc. You have a lot of also tools for the clinical access to clinical, finding clinics. This is probably the most basic things. Do not connect so much with personal data, but many of those companies are based in business models that they aim to be the entry points of healthcare data. They aim to identify you and then collect and help to collect data connected with you. Because the main challenge in healthcare data is knowing where your data is. Because if hospitals are not speaking with each other, often hospitals have first and last name, the other has the full name, the other has your mother's name instead of your father's, so you probably get lost. And probably Italy has a good system, but you move to Germany, and it's difficult sometimes to combine these kind of things. So a lot of these tools are trying to articulate and combine information among each other. So it's always tricky, even with basic tools like this, because in the end, health data is the goals. You often become the product, the product rather than the client on digital health. Of course, you have a lot of things being developed on diagnostics, imaging using AI to look into images, to look into pathology. So a lot of now pathology centers, you don't have people looking into samples anymore. They just run it through a computer. You do the counting, you do the identification of coronavirus, for instance. These kind of things are being run by already digital tools. And this is creating a lot of data with a lot of more potential when it connects not only that specific case, but a lot of the cases. Actually, these technologies are arising from the ability of grasping huge amounts of data. You have public institutions, huge initiatives in Europe that try to grab this information. So with a big pool of information, they can develop the AI algorithms running on it. So the main challenge many of the times on these tools is not the AI system. Like I was working in imaging for AI, and I was able to do all the AI from scratch without never did the AI system in my life. Just running some scripts, public libraries of AI. The issue is actually the data you had to play with, and that becomes the biggest issue. So the goal is not only for the big guys, it's also for the small guys to do innovation. They need to have access to healthcare data. And that, again, is a main challenge, because we are jeopardizing innovation because people do not have access to these amounts of healthcare data that are needed to bring innovation forth. But at the same time, in which conditions should we give them access to that data, and how are we sure that we're protecting? Because even using the best standards, the best China I/O, in the end, is what people do with the data that is critical in the end. So just to finish on the applications, you have a lot of things also, clinical trials, drug discovery, real-world evidence, so how you collect actually what is happening into the markets. A key trend here in the end, and this is why it's become interesting, is because you have big companies running into health. Google, Amazon, Microsoft, IBM, a lot of what are the traditional tech companies have big arms now focused on health. So this is, for instance, the example of Alphabet. This is some of the companies and business that they have connected directly with healthcare. And what they are interested on data. Hosting the data, providing the tools to manage with the data. Also, is that you're seeing consumer retail moving into healthcare. So pharmacies are no longer the delivery points of digital health or health solutions. Google Play, the App Store, and even Best Buy are places now that you go to get health devices that can harm you, that can collect your data and misuse it. So this becomes a big challenge, because you are opening even more the access of things that often were so critical because happened inside the hospital, inside the pharmacy, or really connected people that knew about the fields. So this is, in general, the trends. I just wanted to bring quickly some challenges on the adoption and some challenge on the tech. So quickly, the big challenge of adopting of digital health is because it changed the business. How do you pay a doctor if people are getting treated at home? How you pay a nurse that was used to get paid by the hour to do physical therapy or physical therapists, when is a computer now doing that? So how a hospital will work when all the financing that is given was the amount of treatments it provided. So it was not based on the improvements of someone diabetes or based on someone getting better. So it becomes a challenge, because a lot of these technologies are changing the existing business models. And again, those people are there to earn their money, so it's difficult to change and push people to adopt if you do not come up with the proper business models. And the challenge in healthcare, often there is one payer in the end. So if that payer do not decide to pay differently, you can push your amazing technology that solves cancer. If nobody's paying or willing to pay in the end, it's not the doctor that can do anything, it's not the nurse, it's not often the hospital director. A key challenge also for digital health is that you need evidence. You still need to prove that it works, that it's able to deliver what you promise. Otherwise, it does not get paid, and otherwise, doctors, nurses, all the people that are still the key elements of advising people on their health, they will not recommend it. The way you probably took most of your medications was because the doctor recommended you. So it's quite key to work with these people, and these people are based in evidence. And it's still quite tricky to collect evidence in an app, because the way your diabetes, for instance, are reduced using a food management app are so complex, the variables. It's not simply you took a pill, you got better. You took a pill, your blood pressure went down. It's difficult to measure a lot of these outcomes because some of them are not so immediate, are more long-term, and depends on so many things that, for statistical, this is a big issue. So this is a field that requires a lot of technology, a lot of new methods, a lot of new science to be able actually to monitor what you're developing. And then of course, we have the challenge on the ethics and the liability, because it's not only the data protection, but it's also who is responsible for the decisions that a machine does. And you don't want to be the doctor that is near the machine that misdiagnosed someone or that killed someone. Even if you are not responsible, you are the nearest human to blame. Who is to blame when a Tesla hits someone in the street? It's the driver, even if it's not driving the car. It's not Elon Musk that's responsible by the car and the algorithm. So it becomes a quite challenge, and a lot of the new technology is still limited because people don't want to be responsible. People don't want to give access to healthcare data because they don't want to be the ones that gave authorization to someone to use the data, and then something comes up, they were the responsibles in the end. Even if they used the best standards, even they did the best thing, that 0.01% chance of something happen bad is always in their minds. So you need to revert this, and that's why it will take time. And this is change that takes time to adopt technology. A key point in technology, I said in the beginning, I'm a biomedical engineer, so I'm not here preaching something on their social. I'm an engineer trying to push things in health and discovering that I need to spend 90% of my time trying to change people than doing technology. And change takes time. You need to change behaviors. You need to teach people. You need to change the way management works. You need to change process, and it's not easy to change many of the times all these things that are so much established. And in the end, you need to show results to prove people that this works. So it's difficult sometimes if you don't have the results to even do the previous, and it comes back to the challenge of evidence. So this is, in general, the issues of moving technology into adoption. I'll bring you a little bit challenge on technology. One of the most interesting things that came to me was, so when I was at MIT, it was like the boom of Bitcoin, blockchain for this, blockchain for that. So I had a lot of people working in small research groups that with decentralized blockchain things, then there is like 50 million to solve healthcare issues. Like we are now 5 years later, no blockchain yet. I bet half of you know how to do things in blockchain, so it's not a matter of coding on the technology. So it was just how you're saying before, is a solution trying to fix, to find a problem in healthcare. So let me start with the first challenge, is cloud computing. There is still a lot of the institutions are not yet connected with the cloud. A lot of the countries are still trying to make the data accessible. And the issue is that many of those places, when they do this, they do it so badly that instead of promoting this adoption, they are actually going backwards in many of the cases. Just recently, some people discovered that some imaging clinics, they had like millions of images just open, an API that you can access millions of images because they just didn't encrypt it or secure the access to that API. So as long as you discover the proper API, you could access all their data. Like basic things, so it's not a matter of technology many of the times. So it's how you promote that technology in the way that can be adopted at the widespread. This needs to happen. Still people hack your email, so this is not so different from the general issues with security, but still is a big issue. So this is the first step of cloud computing that we are still working on that. Of course, as I spoke about blockchain, distributed storage is something that is coming and has been speaking and is still a challenge. The point here of using blockchain is to promote what is called distributed storage. So instead of having one institution storing the data and you access that institution, in some way you can spread the data between people, different institutions, and in some way share the liability and do not have a single point of failure into the system. So this is the basic principles of using blockchain. Then in some way you have different nodes that have the same data stored and encrypted or protected in their own. What then you have with blockchain is the transactions being registered. So probably the main interest application of blockchain in healthcare is that now you know that your health record was not changed. That when the machine issues this reading that is in your app is the true reading from that machine. Because it may seem harmful, but actually if you imagine that you are doing a customized medicine for you using that data. And a hacker accesses your phone, changes your records, and you get the wrong pill and you can get killed. So there is a lot of things that may be an issue in this field, that in some way, if you can track the data, if you can make sure that the data was not tampered, will actually be of a huge benefit from you. So usually how blockchain works in healthcare, on how the majority of people think and are trying to implement it, is not put data on the blockchain. By the way, who here has never heard about blockchain or do not know about blockchain? Okay. So the basic principle here, so you have all the data that you collect, you encrypt and sign the data, and then you put the data randomly stored in what is called a data lake. So is you can call it pseudonymized data in some cases, other is just encrypted data, and then you store in the blockchain the keys to access that data and where that data is stored. So the blockchain is just to manage authorizations, sharing access, storing the access to the data. So it's not putting the data in the blockchain. So the goal here is mostly to help you share data among people in an easy way, while the data can be still on China.io, easily accessible and securely stored. So this is an example of a workflow of actually a patient assign permission to someone to access their data instead of actually having a centralized entity like a hospital that defines if that doctor has authorization or not to access that data, because often those authorizations of access the main issue of security in many of the cases. So in some way you move from what is centralized, then you have this decentralized. For instance, Google, Amazon is how they deliver your content to you. They have servers around the world with copies of the data, and you're just accessing single nodes. So the goal here is no longer no one has your data, only those that control the access to it, and then it becomes you that controls the access to your own data. I like a good example of an application that is not yet applied to healthcare. This IPFS, so for you more geeks, is the interstellar protocol for file storage. So the interesting thing is the basis of interstellar is like if you need to access a website that is hosted in Mars, with the current technology, how are you going to do it? Because the speed of connection will not be enough. So what they aim is that actually the data goes through the network. So as long as you have someone near you that accesses that data, you don't need to go to the main server to access that data. So imagine the potential of using this blockchain approach to countries where you may not have even internet connection, or you are limited on the connection, for instance, to your hospital in the US, but you are now in China, but the hospital in China can access your data directly from you because you are the nearest node for them. So this enables a kind of connectivity and access to data in a different way. So this is, in some way, the challenge of things that can be used for blockchain, but there is yet a lot of challenges. It's not only technology, it's how actually you put people trusting this when they are still trying to trust cloud computing. So just to finish, I'll probably skip the video because the video was bringing a little bit using different kind of contracts to allow people to do computation on your data. Because the last layer, and for me the most challenging on the tech side, is actually the distributed computing. So it's not only when you store the data, but when you can compute. So run an algorithm if I can actually do an assessment of your healthcare status here in this room, accessing all your cell phones, but never being able to see any of your data. And doing that assessment that makes me learn things about us, discovering new medicines, discovering, for instance, some trends, but never being able to actually tap on your information. So this is what is called distributed computing. There is some uses of the blockchain with smart contracts, things that becomes more evolved on how actually computers can speak with each other. But I bring here probably what is something that being developed quite recently that is using the homomorphic encryption. That in some way that you do computation in encrypted data. So this is nothing to do with blockchain. This is actually the ability for you to run computations in data that is secured, and you get a result that is encrypted and secured as the data, and you can share that information back to the person. So in some way you can have companies running the algorithms with their code, with their technology, providing the service, but it's still the person that gets the results, the owner of the data. They never share the data, they just share encrypted data, and they get a result that only them can see. So only them can share and do this kind of thing. So this is something that's being looked into healthcare. The big issue with this is it's so slow. So if distributed computing by itself, when parallel computing, we're not using encryption, is already something often slow, but you leverage the power of the processors in different places. Like when you speak with Alexa, it's a lot of computers basically processing your voice and giving you back the result. It's not your phone processing it. But when you do this encrypted thing, like the first attempts, 100 trillion times slower than just using non-encrypted. And they still managed to improve it by 2 million times, but still in the trillion. So it means that 1 meg of data, just to give you an idea, an MRI, like a brain MRI can be 100 megas, could become 10 gigabytes of encrypted data, because in some way, when you encrypt data, you put a lot of noise. So you are limited by the number of operations you can do. So this is a multiplication. This is the second multiplication. This is the third. At the third, you can no longer go back to original data. So try to do most of the algorithms that we are using now, a simple AI with 2 multiplications. So this is still a tech challenge that we have today. You can do addition, probably is an application that you can do with this method, but multiplication takes a lot of time to do compared with traditional data. So this is to bring a little bit on the promise, because actually this is now being applied by a company, a digital health company, Nebula Genomics, that is trying to go against the 23andMe's of these worlds. This is a company that's spin out from the guys that do the machines that reads the genomes. And they are doing basically that. They do a whole ecosystem of selling data to pharmaceutical companies, but they don't sell your data. You sell the data through their platform, and you have a token system in a way that rewards both the company and both you for the data that you authorize to share, because they never own your data. So this is the holy grail probably of health data in the future, is when you own your data, you can leverage innovation technology from your data. People can access data for what you allow them to do, but still there is not a point of failure in the way that you don't need to trust a second entity in the process. So this is in some way an overview of things. Some of the things still far-fetched, but a lot of things being a reality today, but still technology often is not the limitation. So thank you.
All right, thank you, Miguel, for the state of the art of the healthcare right now in tech. So we have some questions, not too many, because
I also have a lot of questions.
Yeah, I do have a lot of questions. But well, so first question is: can we expect innovation in this field more from the private or public sector? This is, to me, a very interesting.
Together, I think if there is not, especially in Europe, if you don't have a buy-in from the public sector, it will be tricky to have innovation. For instance, coming to example in Portugal, we are an example in Europe in telemedicine. Nobody knows that we are doing telemedicine. People are just using, because someone told to the doctor, now you send the pictures of the skin of someone in this app, and someone in the hospital will say it's like cancer or not, or should check it in the hospital. They never try to promote it as this fancy new technology, just push it because it came from the bottom, and it was developed with the doctors. The difficulty is when you try to make changes when you don't have the relations of trust. So coming from the public is always a better way to build that trust.
Right. Especially in Europe, right?
Especially in Europe. Yeah. In the US, that's why a lot of these companies are in the US, because then it becomes a more direct
Yeah, they're a little bit more relaxed with regulation usually.
Depends. Yeah.
All right. I mean, I'm not saying it's good, so but it's kind of a thing. So they're asking you, how many of those companies are actually active also in Italy?
Probably.
If you have any idea about that.
From those, actually I deleted the slide with the map because they were origin of the countries, but most of them I would say are not active on Italy, because you need to go country by country, and most of the European countries are too small for them to care about the regulations of the local countries. But for instance, Babylon Health, you can install it, or I could install it a couple of years ago and test it. But I cannot, of course, get my appointment with my doctor through it.
Right. Yeah, I would say that since Italy is not like the biggest market in Europe, I would never
it's the biggest
start
issue in Europe. That's a work I did with the IT Health on trying to how we can improve the way digital health goes to the market, and we are too small to spread to different regulations. You have a lot of the companies that develop in their country, so they become known in their country, or they can adopt their country to go. They try to go, for instance, to Austria or Switzerland. They need to start from scratch. It's completely different. They need to change the product. It's not only the language. Some of the times, is one country is a nurse, in the other country is the doctor, the client, and it changes a lot the business. That's when in the US, often you have like 300 million people
I
with a single
believe-
business model.
Yeah, I believe this is one of the fields where Europe could make it count the better, because if you are able to lobby enough to make some things common between all the states,
But
you
it's
can
tricky. It's
you could
tricky.
actually have some scale for those.
Healthcare is actually
companies.
one of the national things in Europe still. So we have quite similar national healthcare systems, but it's like each country fields. So it's difficult to touch that. It's like
Right.
if you don't want like more exits.
Yeah. Yeah. Right. So last couple of questions. So they're asking about genomics data. Could you say more about the misuse of that data from law enforcement? The police trying to find their relatives from crime scenes.
That happens.
Yeah.
So there was already one case of someone that was found because they didn't have a complete DNA sample from the case, but they run it through the platform and they find some some relatives of that DNA, and in the end they discovered who was the person with a full DNA sequence with that. So that is not a misuse, it's a good use of that practice, but if you put that in the Chinese hands, or some new dictators that are now appearing all around the world, it becomes a tricky, because you cannot change your DNA. One thing is probably your glucose level. Probably 1 month from now is quite irrelevant for someone, but your DNA, you cannot just change it.
All right. Well, there is another question regarding private versus public, but I believe we already covered that. So, well, this is probably easy, but it was probably even easier for Jovan. Does the US have something like the European Union GDPR? Yes. Thank you. Yeah.
Actually,
High PAA, the HIPAA. If you're curious about that, Jovan is a nerd about this.
Yeah. But in the US, they are quite a legal country, so often the issue is liability. For instance, image diagnostics. Do you have Alzheimer or not? Probably 10 years ago, a doctor saw your image and said, okay, this person probably has Alzheimer's. So he did the diagnosis on the image. Today, they just write a so fancy thing that only a doctor can, probably this is Alzheimer, because they don't want to be the liable person saying this person had Alzheimer, and they didn't, because someone will sue them. That's a little bit the difference on the US and Europe. While in Europe, if it's not regulated, you can do it often. In the US, the system itself regulates itself in many of the cases, but so that's why you cannot compare directly, saying that one is more regulated than the other. But California is moved recently to a more GDPR similar stuff.
But they are kind of a progressive island compared to the rest of the USA, I guess. Well, and this is the last question, but it's for all of you. It's something that I want you to keep in your mind tonight before going to sleep. It's a very interesting question, is what percentage of DNA do we share with the Speck? And I want you all to think about it. The answer could surprise you. The answer is probably most of our DNA. And well, thank you again, Miguel, for being our guest. Thank you very much.
All right. It's been another great night, guys. And girls. I think
Slash others.
slash others.
Slash
I think
programmers.
We will have a couple of good things to be discussed over the night in front of a Speck and a beer. That will happen in a couple of seconds. Just to remind you, please, two things. One, donate. it's-
yeah.
that
Sorry,
thing.
I always forget
It's
that.
actually how we sustain the foundation. It's
Yay.
important for us. We use it to buy the spec and buy the beers. The more donation we get, the more beers we buy.
Yeah, to be honest, we also pay sometimes the flights of speakers and trains and accommodations.
Yeah.
And
Ah,
no, we're talking about no, it's
not
for
you,
other
not you.
speakers. Sorry, Jovan. And
Yeah. And yeah, well, that's pretty it.
yeah, Jovan is coming from very far, from Rovereto, actually. No, it's from Berlin. Tonight is from Berlin.
So, as we said before, we have the next event on the 16th of March. Again, thanks to our friends from EIT Health.
Thank you very much.
Get in touch with them later on. Register on the website, and maybe you might attend the next annual meeting happening in. Last year it was in Paris, so we don't know where it's gonna be next year. Stockholm. Okay. In the winter, okay. Stockholm in the winter. It's a good choice and a good excuse to visit Stockholm and meet a bunch of innovators and people interested in tech. And yeah, that's it.
I believe it's everything.
Have
Yeah.
a good night.
Thank you
Enjoy the
very
spec.
much, everyone. See you next time.